Providers at Arnot Health care for ailments and illnesses across the board. But some of that care couldn't happen without EMTs assessing patients, providing life-saving medical intervention, and transporting them to the hospital.
They're seeing patients in the kind of worst moments of their life and having to act real quick to save lives and to bring them in.
Richard Kimball, director of Irway Ambulance, says they're responding to more calls than usual.
More and more, we're busier and busier, and this just gives a place to unwind. It gives a place in between calls to stop and just eat your lunch.
Or dinner or breakfast. EMTs work all hours of the day.
And working odd hours, 3, 4 in the morning, going from call after call.
Responding to everything from life-threatening health events to traumatic injuries and other medical emergencies.
Our EMS, our first responders, are seeing those emergencies right firsthand. They're bringing them in from the community, they're seeing them right when everything starts, and they're initiating all the care.
When all the focus is on getting a sick or injured patient to the hospital, self-care sometimes falls to the wayside.
You're not always able to get back to the station because we're always moving, so this gives us a place really centrally located where we do most of our work.
Now they have a place to stop once they bring a patient in for care.
This is an opportunity for us to be able to thank all of the partners in emergency services that come to the hospital and help provide support to our staff, to our community members, and to one another.
The same partners who may otherwise go an entire shift without taking a moment to themselves.
Just to have a couple moments to grab a coffee, grab a snack if they haven't had a chance to eat yet. I think it's very important.
Dr. Bohan says working nonstop can lead to burnout. Opening the EMS support room gives EMTs, firefighters, and law enforcement a place to take a breath and regroup in between calls.
Give themselves a chance to be appreciated by the hospital team and know that they have some space of their own here in the midst of a very busy emergency department.
Jonathan says this is a small way of thanking the dedicated individuals who readily serve our community anytime, anywhere. For Arnot Health, I'm Lexi Cutmore.